Welcome back. If you want to know why our healthcare costs are skyrocketing, check this out. In 2016, the average cost of an emergency room visit was almost $2,000, up 31% over 4 years. Why? A number of reasons. Emergency room medicine is the most expensive form of healthcare, and ERs are seeing a greater number of people with severe medical problems. And the state-of-the-art technology available to ER docs is also incredibly expensive, like CT scans and MRIs. Joining us for more is our consumer watchdog, Jerry Zivic, and Marianne Harmson, a nationally recognized healthcare professional and the former executive vice president of Blue Cross and Blue Shield. And we should also point out that we did invite Sarasota Memorial Hospital to take part in tonight's show. They couldn't make it. We don't want to single them out, but we do want to share a statement that we were given to us. Choosing an ER is the most costly place for care because people are paying not only for the tests and treatments administered during their visit, but also the overhead costs associated with a 24/7 access to specialized care that hospitals provide 365 days a year. Providing around-the-clock emergency care requires staffing in multiple areas, including the ER, laboratory, radiology, pharmacy, surgical services, general and intensive care units, plus on-call physician specialists in more than 20 specialties and subspecialties. And Marianne, let me start with you, because then you get a bill for $125. That's not going to bankrupt you, right, but you wonder why you're getting a $14,000, $15,000 bill.
Yes, and I think the most important thing is to understand that there's such a variety of reimbursement mechanisms that each hospital has a separate contract with each insurance carrier and each physician group. And most importantly, when something happens, you need to understand if you go to the urgent care, it will be one cost. If you need to go to an emergency room, you're going to be looking at many different disciplines. But sometimes those behaviors need to be thought of and can't be judged in advance because the circumstances don't dictate it.
This is an overly broad question, but I'll ask it anyway. Is this one of the drivers in terms of the increase, the rapid increase in our healthcare costs? Because we keep going through this national debate about health insurance and why is it costing so much, and we're redoing, they want to redo Obamacare and so forth. Mm-hmm. But is this really the reason? Well,
it's part of the reason. Part of it is that there's an enormous amount of overhead that's associated with an emergency room. And some of that flows, it's part of the whole hospital system. So depending on how efficient that hospital system is, that will also help to generate what the costs will be that are associated with the procedures. But the federal government sets the ICD, the codes, the billing codes, ICD-10, CPT codes. It's important for people to understand that they do have recourse. I just saw 3 examples, one with a man who had a finger that he had lost and it was reattached, and 2 other examples where the costs were prohibitive that came out of emergency room situations, and they were able to negotiate them to substantially less.
But that is not something that most people feel like they're capable of or have the time to do. Right. Jerry, let me ask you this. I mean, we could talk about the whole process here, but what responsibility does the consumer have to make the right choice and knowing the difference between an emergency that you should go to the ER or where you should go to the 24-hour
Well, there's
walking
something
clinic?
Called the prudent layperson standard, that a prudent person would know that you should go to the 24-hour urgent care versus the ER, and that's very difficult. As Marianne said, you don't know if your child is laying there bleeding, you're not going to measure how much blood is coming out or not. But what I find actually SMH's statement disingenuous, and I disagree a little bit with the whole assessment of ERs. ERs, as Jess said in her story, they're run by another set of doctors. So this is all about competitive bidding. So you should be able to be in a situation where whoever you contract with is giving you a really good bid and you can control what they do in a much better sense.
All right, we are just getting warmed up and we'll have much more on the rising cost of emergency care right after we check the first look at weather, so stay with us. Welcome back. We're talking about rising emergency room costs, and joining us for more is our own consumer watchdog, Jerry Zivic, and Marianne Harmson, a nationally recognized healthcare professional and former executive vice president of Blue Cross and Blue Shield. But Jerry, let me start with you. We have a lot to get through here. But you are particularly concerned in terms of, because we're seeing such a drastic increase in emergency room costs over the years, that the insurance companies are thinking about putting more of an onus on us in terms of deciding whether or not we need to go to an emergency room.
Sure, there's an insurance company out there that has actually told their insureds that they will not pay if you present it in ER and it's not an ER problem. They're not going to pay for you. So I actually was thinking about, what do you do? I would actually ask the ER when you present, is this an ER problem? Because if a doctor's telling you, or the hospital is telling you, yes, you need to stay at the ER, then at least you have some sort of rationale.
Right. You would think some of these issues are pretty simple. You know, if you have a bad cold, not an ER problem, but if your kid is desperately sick, or they're bleeding, or so forth, we're talking about crises for people. How can you make that judgment like that?
Well, it's near impossible, and that's what's really unfair about this insurance company doing this. I talked about the prudent layperson standard, but when your kid is sick, or your spouse, or a loved one of some sort, you want to get them what's perceived to be the very best, and you're going to go to the emergency room. And what you have to do, though, I think you have to plan ahead what I'm going to do in terms of if there's an emergency.
Well, I'd just like to say it's very hard to plan ahead, especially with children, because anything can happen at any moment. We face an incredible situation, because one of the things you said before, Jerry, was the fact that a particular insurance company may try to put the onus of the responsibility at the time of incident on a particular insured. That's almost incredibly hard and difficult to believe that that would even be acceptable under the law. This goes back to malpractice. When in the 1960s, when no fault came in under auto insurance, the next thing we saw was a decrease in those lawsuits and an increase in medical malpractice. So the medical malpractice liability and that tort reform started to create increased margins that had to be placed on costs. And that is the reason why you mentioned before, you said some of the hospitals have physicians who are not even employed by them. They contract with them separately. Well, because then they have less liability, and that liability has to be carried by the physicians group.
I'm going to suggest to you that that's a bit of a misnomer, that insurance companies use this as an excuse, malpractice, to raise costs. Certainly it's a factor, but when you look around the world, you don't see big, tall buildings named after doctors or lawyers. They're named after insurance companies.
And in some ways, I'm agreeing with you. I'm simply giving you the history of how we got from point A to point B.
What about the other costs that drive this basically crisis in the cost of emergency room care, and that is the uninsured? I mean, we keep, as I mentioned earlier, we keep going through this national debate about Obamacare and the Affordable Care Act, and whether or not the majority of people who have employer-based insurance should have to pay for people who don't. But there's still a substantial amount of people who are uninsured who wind up in the emergency room, which we laid out is the most costly form of insurance.
Yes, and so it's referred to as uncompensated care. The percentage of uncompensated care in this country by hospital system varies, but it is an enormous amount of money. Most people don't understand that under the Affordable Care Act, or Obamacare, the subsidies that were put in place so that some people could purchase insurance are going away. When they go away, those people will not have insurance again, and they'll be back, and instead of using perhaps a primary care physician that they had chosen, they are now going to be going to the emergency rooms, and we're going to see more uncompensated care.
Let me ask another controversial question, because I did this story when I worked up north in Connecticut, and that is the amount of money that hospitals wind up spending for undocumented residents. I did the story at Danbury Hospital one year, $2 million. So on one hand, in our national debate, we want to make sure those undocumented residents don't have Obamacare or anything like that. On the other hand, we're paying those costs if their kid is sick and winds up in the emergency room.
And we're facing a dilemma in this country, because as a country, we say everyone should at least have access to care. But on the other hand, we don't have everybody contributing to the system. So then eventually there's the tipping point, and Jerry and I were talking about this before. We've actually passed the tipping point. So we have multiple situations which actually would lend themselves to future discussions because it's a very complicated matter.
Jerry, I've heard analysts say, look, bottom line is healthcare costs and emergency healthcare costs, there is no good plan out there. This is something that costs the healthcare system a lot of money. But again, from the consumer point of view, and this is complicated, we all live very busy lives, but what should a family do in terms of preparing for that day that they have an unanticipated emergency medical need?
Well, I really believe, even though it's hard to react appropriately in emergency, but I really believe right after the show, everybody should sit down with their insurance policies and review them and see what's covered and what isn't covered. Even if you've reviewed your policy when you first got it, 8 months later, do you really remember what's covered or what's not covered? And you have to look at even an ambulance. How, do you want to use an ambulance? Or do you want to maybe use an Uber or something?
Let me ask you this, because if you take that woman who was in our story,
Yes.
The cost was over $100,000.
Yes.
Her part of the bill was $100.
Mm-hmm.
So where is that?
Why is that covered that
Yes.
way? I would tell you that the procedure that she described is an electronic stimulation that is done to put a heart back into rhythm. So the situation that she described, when a heart is not in rhythm, it can lead to a massive heart attack. So she was in an imminent danger. So that's why the insurance company, then when they saw what happened in the emergency room, why they did what they did, then they paid it as if she was admitted into the, well, she did say she spent 3 days in the hospital. She may not have left the emergency room because sometimes they don't have beds upstairs and they keep them in the emergency room bed. But that is the reason why that one was paid to the extent that it was.
All right, we have to take a quick break and we'll be back for final thoughts in a moment. And our guest joining us right now for final thoughts. And Jerry, let me put it to you this way. Why should anybody care if your out-of-pocket cost on a $100,000 emergency room bill is only $100? One could say, hey, listen, I got out of it pretty good.
Because it's still not $100. The story we had here, so she has Medicare and no doubt she has supplemental insurance. So so you're still paying for that. So it's not $100, it's $100 plus your insurance. And if medical care keeps on going up and up and up, the cost of insurance will go up. The cost of Medicare goes up every year. The cost of the supplemental policies go up. And this is a never-ending cycle. And as we heard here, it's a situation, what Marianne said, there's a tipping point. And we're way past the tipping point. And what if you're just not very, if you're just a person that's working on even a $70,000, $80,000 a year job, it's the percent of your take-home income that you're spending on health care. That's the real problem.
And Marianne, it just so happens that you are starting a new venture.
Yes.
in order to help people understand and deal with this.
Yes, it's called Exigent Key. Exigent means something that requires immediate attention, and clearly healthcare in America requires immediate attention. We have different systems. We have Geisinger, we have Kaiser Permanente. We have some systems that do things better than others, and those are the ones we have to take a look at and see how they're approaching. You cannot look at emergency room charges or hospital charges in a vacuum. You have to look at the whole spectrum, and yes, Jerry, you're absolutely right. The cost of inflation, the cost of technology, the cost of pharmaceuticals continues to rise. So this new company is going to help solve the healthcare puzzle community by community.
Well, we wish you the best of luck.
Thank
you both. But before we go, we want to share with you what some of you had to say about Friday's show. On the week in Washington, President Trump fired his VA Secretary David Shulkin and replaced him with White House Dr. Ronnie Jackson. One of Trump's longest serving aides, Hope Hicks, worked her last day at the White House Communications Director. So we went to Facebook to hear what some of you had to say about all the turnover in Washington. Robert says, as a veteran, the thought of privatizing the VA really concerns me. Ann says, this has all gotten so crazy on both sides of the aisle that I have walked out of the circus. And Noko says, we're doomed. Well, if you'd like to join the conversation on tonight's topic, just visit our Facebook page at facebook.com/mysuncoast.com.abc7. And FYI, you can watch past discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. And for the latest on local breaking news, don't forget to download the updated version of our app. If your current app doesn't work, it's expired, just go to the App Store and re-download it by searching for WWSB or My Suncoast. We want to thank both our guests for being here tonight. Our consumer watchdog, Jerry Zivick, and Marianne Harmson, a nationally recognized healthcare professional and former executive vice president of Blue Cross Blue Shield.